Skin is sensitive to the effects of radiation, and a radiation skin reaction is one of the most common side effects. Even though everyone's skin tone is a little different, the effect of radiation is fairly consistent and pretty predictable, but there's really not much of a change in the first week. For some treatments, by the third week, the skin begins to get a little bit pink or a little bit darker. The last week of treatment and for a week or so after is the peak of the radiation skin reaction, and skin can appear quite red. By 2 to 4 weeks after finishing treatment, the redness begins to fade and turn into a sun tan or a darker appearance. This darkened skin reaction fades away at its own pace, and everybody's different. Sometimes it takes 1 to 2 months, sometimes it can be much longer, sometimes that darkened skin reaction is permanent. The arc of the reaction is somewhat predictable, with no reaction in the first week, the beginnings in the third week, a peak towards the end, and resolution 2 to 4 weeks later. Side effects of radiation on the skin include reddened skin, which is called erythema, darkened skin, which is called hyperpigmentation, dry or flaky skin, sunburn sensation, or blistering or peeling. Radiation skincare tips include gently scrubbing in the shower with a mild, unscented soap. It's a good idea to check with your care team before starting any other products like creams, oils, or powders. Sun protection is key, especially in the first 6 to 12 months, because a bad sunburn can lock in the effects of radiation. It's better to wear loose-fitting clothing during radiation and avoid scratching, shaving, or smoking. Somewhat less common but also possible late effects of radiation include fibrosis, which is a thickening of the skin. It can make skin feel more tense, less stretchy than it used to be. Telangiectasias are what we usually call spider veins and are possible many years after radiation. An extremely uncommon but possible side effect of radiation, especially in folks who have a hard time healing, is necrosis or tissue death. Many radiation centers recommend the use of calendula cream. Typically, patients start 2 days before treatment, will apply 2 to 3 times per day, and avoid applying 2 hours before radiation. Radiation therapy can cause hair loss. Not everyone has hair loss, but it can only occur inside the field. So a patient who's getting radiation for prostate or breast cancer does not lose the hair on their head. Some chemotherapies can cause hair loss, and if patients are getting chemotherapy with radiation, they should check with their medical oncologist to see if hair loss is a side effect. Radiation-related hair loss can be temporary, it can be partial, or complete. Typically, hair loss starts 2 to 3 weeks into treatment. While hair loss is sometimes permanent, usually hair begins to regrow 2 to 6 months after completing treatment. This is not medical advice. Talk to your doctor before making any medical decisions.